Hello, I'm Karen Giffen, and I'm the Senior Director of Development, Community, and PR for Hospice of Washington County. And we are very excited today to be bringing you a special Healing, Hope, and Health right here from the first hospice house in Washington County, Dewey's house, which we call the house that love built. Recently, 400 people attended the ribbon-cutting dedication for Dewey's house, which is expected to be open in late October. I am here with Tom Newcomer, the chair of the Board of Directors for Hospice of Washington County, and Neil Glessner, whose vision started this project, and the home is named after his mother, Doris Doey Glessner. Thank you for being here. Let's start with Neil. Can you explain how this vision started Dewey's house?
Well, it all started due to a personal experience when my mom had a very brief but difficult battle with ovarian cancer. That experience taught me truly what hospice does, and I also learned at that time that we did not have a hospice house. The reality was when my mom resigned her fight and she was discharged from the hospital, there wasn't really an appropriate place for her, and moving her home was a very expensive option. And Dewey's house now fills that void.
Well, it's very beautiful, and you should be very proud of this, Neil.
I am.
And Tom, can you describe why the Board of Directors would get behind this vision and how it fits into the end-of-life care as a whole in Washington County?
I think one of the things, our board is made up of a lot of folks from really across our community. And it was an opportunity for our board and listening to the staff to say, you know, this is a critical need that's need to be met in this community. Essentially, we looked at the idea that we provide excellent professional care for patients and their families in the home setting. But we really wanted to also be able to provide that same kind of setting for special needs, for very intense medical care in a residential setting. So the board wholeheartedly embraced this and supported it and came on board to do exactly what our staff and the community wanted, which was to create and build Dewey's house.
And we thank the Board of Directors. They have been great support. Neil, can you describe the support of the community has given to this project?
It's been amazing. I always knew that we lived in a great community, but I didn't know how great until I got involved with this project. I sort of described this project as far as getting it started as the idea of a hospice house. It was like a gigantic boulder that was teetering on the top of a mountain, and all I did was tap it, because as we went to folks and asked for their support, there was incredible support. You know, we had Bushy Fight and Morin architecture firm here in town who we didn't even approach. They approached us because they had overheard, Brent Fight had overheard me discussing with somebody else about this project, and he was excited about it and said, we want to support the project. We want to provide the architectural services for free. And then he rounded up all the subcontractors as well. And there have been close to 2,500 supporters that have made it happen.
And I think if you look around the house, you can't see anything that probably wasn't donated to hospice. Tom, can you tell us about some of the major partners that assisted the board?
Yeah, I mean, one of the things that's really important, especially for the quality of care and end-of-life care, are some of the other partners such as Meritus Health. And they really worked with us so greatly, not only in providing the land here that Dewey's house is built on, but also in partnering with us in terms of the kinds of things that we could do that would best provide the best quality of service to end-of-life care in our community. So we thank Meritus very much. The state of Maryland, through our local delegation, was wonderful and came together and supported us through several bond bills, which really helped to, again, underwrite and finance Dewey's house for the community. So a lot of great community partners. We're very appreciative to them and thankful to, you know, the community at large.
Well, I think definitely everybody has played a part in the house that love built, and we can't thank both of you enough for your efforts and your hard work. And I know, Neil, that the ribbon cutting was so wonderful with a number of people. Can you just describe what that meant to you?
Well, it was very exciting, but I think it also symbolized the support that we've been receiving through this entire project. I've never been to a ribbon cutting where there were so many people at it. And you know, and I just think it's because hospice has touched so many people, and our message has been, you know, to get involved with Dewey's house, that it is serving a great need within the community. And when you have a loved one that is struggling, or you know somebody that has a loved one that's struggling, you never typically know what to do to help them. And being part of this project is the ultimate thing to do when you want to help somebody in that situation.
Well, and I believe that this started with your story, and it became over 2,000 people's story. Every paver, every sign, every piece of the house you can tell is somebody's hospice story or their own story. So we thank you. It took a lot of people to make this project happen. And I know we can't thank everyone. You can see the names on the signs. So we want to thank both of you for your excellent leadership. We want to thank everybody that's been a part of this, and you should be proud of your efforts.
Thank you.
Thank you.
I'm the hometown favorite.
I'll outsmart you.
I will beat you.
I'll be surrounded by fans cheering me on.
There's no place like home for fighting cancer.
My turf.
My time.
My team.
Expert care, close to home. The John R. Marsh Cancer Center at Meritus Health.
Living with a chronic disease is a daunting situation, but with help from Life Care of Washington County, you don't have to feel overwhelmed. With our palliative care team, we can help you manage symptoms and the weight of illness. Life Care of Washington County is there by your side, maximizing treatment options, increasing the quality of life, and partnering with you as you face the challenges ahead. Life Care of Washington County, we're with you. You don't have to struggle alone. Call today for a private consultation.
Welcome back to Healing, Hope, and Health Special Edition at Dewey's House. Joining me now are two vital directors for Hospice of Washington County. They are Maria Long, our Senior Director of Operations, and Dr. Elva Baker. He is the Chief Medical Officer. I'd like to welcome both of them and thank you for all you do for hospice and their families here. First of all, start with Dr. Baker. Can you explain the definition of hospice care and its importance?
Sure. So hospice care is care when patients arrive near or at the end of life. And the whole purpose of providing hospice care is to help improve quality of life, and that's done by managing symptoms of any kind. So whether it is pain or anxiety or nausea or vomiting or shortness of breath, whatever symptom the patient may be having, that's what we're there to manage.
And Maria, can you explain how the team approach is done working with our patients?
Yes, our approach as hospice is to meet the needs of the patient physically, mentally, and spiritually. It's also to support the family and the caregivers during their time with us. Each team's comprised of an RN case manager, so that's the nurse who leads the team, a social worker, a chaplain, and we assess for the needs for certified nursing assistants, for volunteers, and for bereavement services. After the patient's been admitted, each of those disciplines comes for a visit, sets up an initial visit to meet with the patient and the family to gather information and to work with them. Typically, our nurses see our patients at one time a week, at least one time a week, but we strive for 2 times a week. And then more visits come as needs arise. Also, the social worker and chaplain go in that first 5 days, and then they come in every 14 days. The CNAs, the volunteers, the bereavement staff, all are done according to needs.
So a lot of people working together to make this happen.
Absolutely.
And we have 4 teams, correct, in the field at hospice, and I guess Dewey's House would be our 5th team. So, and Dr. Baker, can you explain how a person is admitted into hospice in general? But then, can you explain the eligibility to be admitted here at Dewey's House?
Absolutely. So in order to be eligible for hospice, somebody has to have a life expectancy of 6 months or less and not be receiving any aggressive or curative treatment for whatever disease they have. And it takes both the patient's attending physician and the hospice physician to certify that those 2 statements are true in order for somebody to be eligible for admission to hospice. Then at Dewey's House, we provide a special level of care called general inpatient. And general inpatient is care that looks at managing very intensively whatever symptoms a patient may have, and usually it's because the patient's symptoms cannot be managed in their home. So they will come to Dewey's house to have those symptoms managed. And in order to qualify for that, they have to have symptoms that need that intense treatment.
And we'll also have respite care here as well at Dewey's house, is that correct?
We will have respite care here, and respite care is when a patient may come and spend a few days here in order to give the caregiver or the family some time for rest themselves, or perhaps they need to go away or have some minor procedure done or something like that.
And short-term residential stay here, can you tell us what that would mean?
So short-term residential stay is where somebody who doesn't need general inpatient care and they're not coming for respite, they come and they may stay for several days longer than either of the other two types of patients. And their care is basically what they would be receiving at home. And that's for a short term, so that perhaps there's a home situation that is in flux, or somebody has to be away from home for a greater length of time.
So average stay at Dewey's house would be about 3 to 5 days, and I believe that we're anticipating about 500 patients in the first annual.
That's right.
First year of operation. Well, Maria, this is a lovely house. It is beautiful, and you have been very vital in working on this with our contractors and our engineers. Can you describe the layout of Dewey's house and highlight some of its amenities?
We have as home-like environment as we were able to make it. We still need to be able to provide medical care here, but we have 12 rooms, and each room is private. So individual patients come in, will have their own room. In those rooms, of course, there's a hospital bed and supports for the patient, but there's also a lot of support for the family. We have sofa beds, 2 in each room, comfy chairs that you can sit by the bedside. We have a patio that goes off of each room that the doors are wide enough that a bed could be taken out onto the patio so a patient can enjoy the outdoors, or maybe even their pets could come and visit with them out on the porch. We have a family room, which we're in right now filming. When you're visiting the family room, there's a place to do computer work. We have a TV in here. We have our library, which is a part of this room that you can get a book to read. We have a children's playroom, so if families bring small children with them, that they can have a place for the children to play. We have a spa area with a whirlpool tub, family dining areas, so there's places for them to enjoy their meals, and just a home-like environment. We kept it as much home-like as we could.
Well, I want to thank you, because this is a beautiful place. It's going to be wonderful for its patients, for the patients and the families. And this is a special show here, and I know you made this possible, both of you. You both played a pivotal role in the creation of Dewey's house, and also in hospice. So I want to thank you both, and we'll be back soon with the next segment.
Living with a chronic disease is a daunting situation, but with help from Life Care of Washington County, you don't have to feel overwhelmed. With our palliative care team, we can help you manage symptoms and the weight of illness. Life Care of Washington County is there by your side, maximizing treatment options, increasing the quality of life, and partnering with you as you face the challenges ahead. Life Care of Washington County, we're with you. You don't have to struggle alone. Call today for a private consultation.
Welcome back to Healing, Hope, and Health in our special edition at Dewey's House, and I'm Karen Giffen. And with us now we have a very special team, part of the team working at Dewey's House. We have our clinical manager, Pat Stein, Hillary Evans, who is serving as an RN at Dewey's House, and chaplain Jeff Castro. These are three of the excellent clinical staff here that will be working with our patients and families. First up, the leader of Dewey's House here, our clinical manager, Pat Stein. Welcome.
Thank you.
And Dr. Baker went through the types of patients at Dewey's House that will be here. Can you review the type of patients and maybe where the referrals will come from here at Dewey's House?
Absolutely. So the type of patients that will be coming from Dewey's is twofold criteria. The first criteria is they must be a hospice patient. So they will have a terminal illness. Along with that, they will have a prognosis of 6 months or less. After they meet that criteria, the next criteria is that of a GIP patient. So that general inpatient is what it stands for, are patients that have pain and symptoms that are out of control that cannot be managed in the home. Those pain and symptoms then would be managed at Dewey's House. These types of referrals can come from a multitude of entities, and those entities would include out of the community. They would come from assisted living, skilled nursing facilities. They would come from the hospital. We are very close in collaborating with Meritus Medical Center. They can also come from families and friends. They can call in and feel that their loved one may need Dewey's House, and we would evaluate that at the time. And in addition to that, they would come from our providers in the community.
And I know that if there is a referral, they can call Hospice in general at 301-791-6360 and get more information both about hospice and about Dewey's House as well. And Pat, we know that hospice has an excellent staff out in the field. We hear that all the time, great reputation. Really, they believe in it, they love it. And I know that you're gonna have the same here at Dewey's House. Can you tell us about our professional team here at Dewey's House, what we will see?
We do. We have an excellent interdisciplinary team, and that starts with our medical director. He actually guides our interdisciplinary team, and then myself, the clinical manager, who oversees the clinical aspects of the facility. We have registered nurses such as Hillary, who will be one of our strong registered nurses here at Dewey's House. She is very skilled to be here, and I'm very excited to have her on board. In addition to that, we will have licensed practical nurses. We will have certified nursing assistants. Then we have our social workers, and we have our bereavement team, and we also have our spiritual counselors, in which you have one with us today also. And that is Jeff, so I'm very proud to have this team aboard. The team comes together as an interdisciplinary team to provide excellence in end-of-life care.
And I think in addition to that, we'll have some volunteers here at Dewey's House.
Absolutely. Our volunteers will be here from 8 in the morning until 8 in the evening, working the reception desk and just filling in as we need them, and they are a very strong part of our interdisciplinary team.
And I know that they're also creating flowers for the patient rooms.
They are. We do have a flower room in which our volunteers will come 2 days a week, and they will put together some flowers, and those flowers will then be put in our patients' rooms to enjoy.
So it sounds like a great team, and I know you have everything at hand. You're training everyone. I know we're anticipating to be open in late October, and I know you're working very hard, so thank you with that.
Thank you.
Next, let's go on to Hillary. Hillary, you've been working for a little while here at Hospice of Washington County, and we appreciate your hard work and dedication, and I've seen you out there in the field with your patients, and I know that you really take that extra care, as all our staff does. But can you explain the role of an RN here at Dewey's House, and maybe some of the nursing skills that people will see as you're working with your patients and families?
Absolutely. So I will be here. We will have one primary nurse, which will be the team leader. Pat went over who all is part of the team, and we will work diligently to make sure that the symptoms at end of life are managed well. As a nurse here, I'll be doing more of the admission process, making sure that I know their past medical history and how to treat them the best way that they need to be treated at end of life. Also, myself as the RN and an LPN will be responsible for the medication management. We'll be administering the medications, making sure that the doses are appropriate, and getting changes as we needed by the physicians to make sure that they're the most comfortable at their most vulnerable time.
Well, we thank you for what you do, both in the past and future, and I think that this will be really a nice addition to the hospice benefits as we move forward. Jeff, you've been a chaplain here at Hospice of Washington County, out in the field, working in the field. Can you explain the role of the spiritual counselor here at Dewey's house? And I also know that we have a meditation room as well.
Well, I will be one of several chaplains that will have a presence here at Dewey's because relationship is very important to us. And there will be some patients that come here that already have a relationship with one of our staff chaplains. Maybe they're coming from home. And that chaplain will likely follow them here and provide care for them here because there's a lot of trust involved. And peace is very important. It's a precious commodity in life, and especially so at end of life. And that's essentially our mission here at Dewey's, is to provide the comfort by assisting and facilitating peace. And that's where our meditation room comes in part. Some of the peace comes from just conversation, spiritual presence. We can provide small services, religious observances. But the meditation room really is just a beautiful change of scenery. Sometimes that can be very therapeutic, to be able to just change what you're looking at and what you're able to think about.
Well, and there's also a meditation garden attached to the meditation room. And together, this will hopefully be peace for both the patients and the families. And we really thank you for being with us today. We can see that the patients and families will be cared for and are in good hands. And we will be right back with more information on the first hospice house in Washington County.
People look to steal anything they can get their hands on to make a quick buck, and an unlocked car is always an easy target. Could be a cell phone, GPS, even your loose change. They'll take whatever they can get. That is, unless your vehicle's doors are locked.
The Hagerstown Police Department asks that you keep your car clear of all visible valuables, but most importantly, keep your car doors locked when not occupied. Together, we can reduce this epidemic of theft from motor vehicles.
Brought to you by the Hagerstown Police Department and Antietam Cable.
Welcome back to Healing, Hope, and Health as we continue our show at Dewey's house. I am now joined by the new CEO of Hospice of Washington County, Ernesto Lopez, and Dr. Charles Chaney, who is the Secretary of the Board of Directors for Hospice, as well as the Development Chair. Welcome, gentlemen. Let's start with Ernesto first. Can you tell us a little bit about yourself as you just moved to Hagerstown?
Sure, thank you. Well, it's actually a pleasure to be here. We're new to the area, as you said. We've basically born and raised in Florida, but for a long time we've been looking to go abroad, and this is a wonderful part of the country, and it's a true pleasure to be a part of this community.
Give us a little bit about your background.
Sure. I've been in healthcare leadership for about 15 years. The last 5 years I've been in the hospice industry, and I would have to say that the last 5 years have been the most rewarding for me. It's really special to work with this group of folks, and working to improve end of life in our communities has really given me tremendous satisfaction professionally.
I know that you've been with Hospice of Washington County just a couple of weeks, a very short time, but can you tell us your initial impression of hospice and Dewey's house, and then maybe a little bit about your thought to the future of Hospice of Washington County?
Sure. This is an amazing facility. Everything that was put together was thought through with a specific purpose in mind, to really impact the lives and impact the experience that our patients and our families go through when they're transitioning through end of life. We see Dewey's house as the beginning or the catalyst to continue to help Hospice of Washington County in its mission to extend the mission of end of life care and hospice in a very specific and strategic way. This house will take care of a very small percentage of our patients overall, but we'll be able to extend the way that we care for patients, working with our healthcare hospital partners and our community physicians to be able to educate and bring forth hospice services in a more specific way going forward.
Well, we're very honored to have you. And we know you're coming from sunny Florida to Hagerstown, and we really look forward to what you're going to do in the future for us. And we are very honored that you were selected as our CEO.
Thank you.
And I want to get to Dr. Charles Chaney, who has been very vital in raising funds for Hospice of Washington County and Dewey's House. And I know that you're now working on the next phase, a hospice endowment. Can you tell us why that is so important?
Sure. Hospice, our hospice in Washington County, is a nonprofit and is largely dependent upon federal reimbursement rates. We don't know what those rates will be this year, next year, the following year, so planning becomes difficult. And these rates are largely sensitive to budget crises in the federal government because the Board of Directors foresaw these income possibilities in the future. An endowment has recently been created. And it's designed to supplement operational income so that services like Dewey's House and programs and services both in the home and community can continue to be expanded and improve to our patient satisfaction. And these in fact complement some other funds that we have as well. Those that we already have existing for the CAS scholarship and for the Jennifer Fund, which is for pediatric hospice patients, for charity care, My Wish program, and so forth.
And I know that the goal of the endowment is $5 million.
It is.
And to
or
get
greater.
there, or greater,
Yeah.
yes. Or to get there, we want to build a development council.
Correct.
And maybe you could tell everyone about the development council and then also maybe how you can get involved with that.
Surely. Well, historically, we've done a lot of fundraisers. We've a lot of individual approaches to corporations and businesses and individuals with great success. We met our capital campaign goal. We've restructured the development committee and this development council, if you will, which will increase the opportunities for individuals and for businesses to participate both in fundraising planning and increase opportunities for charitable giving for people of all income levels. So we see that if a person wants to participate in the community in planning events, that's possible at the committee level at hospice. And also it's part and parcel of our volunteer activity. And as you know, we have over 200 volunteers and are constantly seeking others. If you want to participate in the planning, then you should call Karen Giffen at 301-791-6360 or our website, or you can go to the front desk at our offices, which continue to be at 747 Northern Avenue, where a brochure can describe all these giving opportunities.
And Dr. Chaney, we're putting together some committees, some specific committees
Correct.
on the Development Council. Can you explain those committees?
Well, I can. We have a business committee, which is separate and consists of any size business or corporation. They have unique possibilities at charitable giving and supporting our activities. We have a legacy or planned giving group, which will be giving lectures throughout the tri-state area, talking about what possibilities are present in will writing and so forth. And we accept all varieties of gifts at that level. Also, we have committees that are structured to provide small fundraisers and committees that are designed to seek gifts of specific amounts. And we look for participation from the general public in all these levels.
Well, and I think it's important, the operations of Hospices of Washington County pay for itself. So our development actually goes out to increase the services and benefits of Hospice of Washington County. Well, I want to thank you both for being here. I know that the future of the Hospice of Washington County is in great hands with both Ernesto and Dr. Chaney, and we encourage everyone to get involved by calling 301-791-6360 And we want to thank everyone for watching our special edition here at Dewey's house.